We are really excited for our next session. We will dive into a topic that affects every leader in this room: cybersecurity and the rapidly evolving federal policy landscape, which is shaping how providers protect patient data and maintain operational resilience. Our next speaker is here to help us make sense of what's happening in Washington and what it means for healthcare organizations across the country. So Aden is really going to take some time and translate Washington speak to everyday speak so the rest of us can follow along with the very rapidly evolving landscape over there. So please join me in welcoming Aden Klein, Technology Policy Analyst for Premier Inc. Aden is a legislative and policy analyst who contributes to Premier's advocacy work on technology policy issues. He leads Premier's cybersecurity advocacy portfolio and handles issues spanning privacy, data, and AI policy. As a recent graduate of Duke University and an alumnus of the Duke Technology Policy Lab, Aden has contributed to influential cybersecurity and privacy research and advocacy. He has also worked in both state and federal politics and has consulted for the OECD on semiconductor supply chain development. Today, he'll be presenting Cyber Policy Update, what federal action means for healthcare providers. Thank you for being here, Aden. Everyone, a quick reminder for that Q&A section is open, so please, as Aden is taking his time with his amazing presentation today, please enter your questions in there, and there will be plenty of time at the end for Aden to answer all of your questions. Aden, the floor is yours.
Thank you so much, and thank you all for being here today. What I'm hoping to do is give you all a quick overview, a level set of the environment and the key players in DC, a few key trends and issues to watch, and then recap some of the priorities that Premier has been engaging in this space with, along with our members and hospitals and providers around the country. From there, I'd like to leave some time for everyone to ask some questions. Policy is really personal, and I think everyone in this room has a really good sense of what matters to you in your day-to-day, and I want to make sure to offer some time for some back and forth there. So without further ado, I'd love to kick off with a quick overview of DC's political landscape today. So we're nearly a year into the first year of the second Trump administration. So we see President Trump, Vice President J.D. Vance are leading the executive branch. Over in the legislative branch, Republicans currently have a majority in the House and the Senate, but both are fairly slim, which, as we've seen, has led to a bit of dragging and a lot of back and forth and struggles to pass significant legislation. Earlier this year, we saw the One Big Beautiful Bill Act become law through a process known as reconciliation, which requires a simple majority vote instead of the traditional 60-vote threshold in the Senate. That allowed the Republican majority to push through a lot of their legislative priorities. However, near after, we've just come out the other side of a fairly long, actually historically long shutdown, because the votes to pass the standard appropriations bills through normal procedure weren't there for a really long time. So that recently lifted, and the government is back to work. Back in the executive branch, we have a few key stakeholders that matter for the cybersecurity landscape, particularly. In the Department of Health and Human Services, we have Secretary Kennedy, who's taken over an agency that was very active in healthcare cyber towards the end of the last presidential administration. And it remains to be seen quite how he's going to pick up some of that work, including some of the cybersecurity principles and the coordination work that ASPR particularly has been doing. In the Department of Homeland Security, which houses CISA, Secretary Noem has been taking over some degree of coordination work, as well as a pending rule to reshape cybersecurity incident reporting for critical infrastructure and coordination. That rule I'll touch on a little bit later, but CISA and the Department of Homeland Security certainly has a large role to play in the direction that the Trump administration will take with cybersecurity going forward. And then in the White House itself, we have the recently confirmed National Cyber Director, Sean Cairncross, who has recently announced that there will be a national cyber strategy forthcoming that will shape how the US will deal with cyber threats to critical infrastructure, including healthcare. And we have the National Security Council cyber lead. You may notice there's a notable omission here, which is a director for the Cybersecurity and Infrastructure Security Agency, CISA. That's because Sean Planky, President Trump's nominee for CISA director, has not been confirmed by the Senate yet. He's had a confirmation hearing, but the Senate hasn't found the time yet to schedule a floor vote to confirm him to that role. So that's another key thing that we've been watching, and I think matters a lot to a lot of folks around the cybersecurity landscape. So with this state of play, we can see tight margins, new leadership, and an ongoing push to fill some key vacancies have resulted in a lot of talk, a lot of strategy, but not a lot of direct action on cybersecurity yet coming out of DC. That creates a pretty decent state of uncertainty, which is challenging to navigate. But I'm going to do my best over the next couple of minutes here to walk you through what we think may move, what might not, and what the big themes are that can help you to evaluate where we go next from here. So first, I'd like to touch on something that you all know, but is very important to level set in DC. A lot of lawmakers and policymakers don't necessarily have incredibly deep knowledge in an issue area. They touch on a lot of different things. So the cybersecurity folks that we engage with and interact with, they're thinking about cybersecurity as a national security, a national defense issue, an issue that touches on all the different critical infrastructure sectors. So we try to reinforce that there are a few trend lines in healthcare specifically that should shape a very tailored approach to cybersecurity. One of those is that nearly like basically 9 out of 10 health organizations experienced a cyber attack in the past year. Nearly 16% of small hospitals may have to delay or reduce their cyber investments based on funding cuts and changes in federal payments. There's a very high average cost of a healthcare data breach, nearly $10 million, which is the highest average data breach. And that shakes out to about 1.9 million per day of downtime for healthcare organizations, according to some research. And this is all in an environment where the average hospital margin is in the negatives, and so is the median margin. So we're seeing a very tight financial landscape where healthcare organizations face an increasing number of increasingly costly attacks. And we try to stress that context in DC when we talk to lawmakers and establish that kind of narrative because it really shapes the type of response that we get. One thing that's important for the healthcare industry is when you compare healthcare as critical infrastructure to a lot of other sectors, there's a real sense that healthcare faces a significant number of lawsuits, significant number of investigations, compliance requirements, reporting requirements, because of the nature of patient data and the critical nature of their operations. However, that leads to hospitals facing a lot more legal risk and a lot more costly post-event response compared to a lot of other sectors, which will receive more federal support to bolster resilience and recover in the aftermath of a cyber attack. This is just a bit of context setting that I'm sure you're all familiar with, but when you go out and when you engage with lawmakers or policymakers, sometimes it's important to remind them of this sort of information to help make your point about what you would like to see as advocates. One of the most important things to create movement in DC on cyber policy is that different health systems, providers, suppliers, device manufacturers, we all want the same thing. We want to be able to provide care for patients uninterrupted. And I think that's something that is crucially important to reinforce when we discuss cyber policy as a collaborative effort between industry and government to secure patient care, as opposed to an adversarial one where the government is seeking out any sort of mistake or lack of investment in health systems that sometimes gets elevated in the aftermath of a cyber attack. It's nearly impossible to completely prevent an attack. So we can work together to bolster resilience, to limit the downside, and to make sure that it doesn't affect critical operations. So that's just a little bit of level setting. Moving into how Congress is thinking about those trends. We have had a couple of recent hearings. I've highlighted just a sampling of those on the side of the slide here, just to show you the range of different committees of jurisdiction that are thinking about cybersecurity. Generally, in the House and the Senate, one committee will handle an issue, but here you've seen that we've got the House Homeland Security Committee, who's looking at global cyber threats in context. We've got a subcommittee on cybersecurity within Homeland Security, who's looking on regulatory harmonization and all these different conflicting regulations in healthcare. And we've got the House Committee on Energy and Commerce, who's looking at threats in legacy cyber devices. So that right there shows you kind of the range of consideration for cybersecurity. It's all the way up to global threats to the homeland, to regulatory standardization, down to a very specific problem of legacy medical devices. There have been other hearings as well in the Senate looking at supply chain modernization and the cybersecurity of our actual physical supply chains. And there have been a range of other conversations going on as well on privacy and data security. But through all of this noise, we have three big questions that Congress must answer. One is CISA funding. That's and the subsequently the confirmation of the CISA director. The role of CISA has come under scrutiny, as we've seen with some of the debates over extending information sharing, funding CISA itself, appointing full staffing, and a lot of this stems from CISA's previous broadly expansive role and a desire among current leadership to refocus it directly on critical infrastructure threat info sharing. So it remains to be seen what Congress determines the proper role of CISA to be. That's a point of a lot of debate between and across parties, even across party lines. The second big question is how will Congress handle hospital cybersecurity requirements and more broadly healthcare cybersecurity requirements? This is at the heart of multiple competing bills that propose different approaches. We've seen in the aftermath of Change Healthcare and a couple of increasingly high-profile hospital breaches that Congress has a desire to do something to bolster the sector. And this ties back to that narrative that I laid out earlier, where there's this conflicting interest between what can Congress do to compel healthcare to better protect itself versus the actual pressures of making these difficult decisions with limited resources and very sophisticated, often state-backed actors targeting healthcare providers. One approach that some members of Congress have examined is a condition of participation for Medicare that would be tied to hitting, for example, cybersecurity performance goals or another similar metric of compliance. And some bills would instead propose to provide some additional funding for rural hospitals or less resourced hospitals to directly invest in cyber infrastructure projects. But across those different approaches, whatever consensus Congress comes to will really shape the way that we see any hospital cybersecurity bills start to move. Right now, these are all just conflicting ideas that are being discussed in hearings like the ones I've highlighted. Then the third question is national security. Generally, national security and cybersecurity have been closely related, but with more of a conversation around America's financial infrastructure, our roads, our ports, or our energy infrastructure, for example. However, there's recently been a push to consider healthcare more of a national security risk, especially given that some of the highest profile attacks have been by state-backed actors who are being either funded or supported or resourced by America's adversaries abroad. So depending on whether or not Congress decides to take up that sort of conversation and to invest national security level resources into healthcare cybersecurity, that will shape the agency that ultimately ends up setting cyber requirements for healthcare in the future, as well as the amount of resources available to hospitals and healthcare organizations in general. So this is kind of how Congress is thinking about the issue right now. Uh, the takeaway is it's not super clear yet which of these factions will win in any of these issues. But if you follow these three conversations, you'll be able to better parse out what is noise and what actually has a chance of moving forward based on how well it fits into these buckets. Today in DC, we're facing a pretty challenging time for cyber. We're kind of in a holding pattern, which you may have gathered from my first couple of slides. On October 1st, CISA 2015, which is not the bill that authorized the agency CISA, rather it's a cybersecurity information sharing law that provides protection for organizations to share cyber threats among each other. That expired, and a grant program for state and local government cybersecurity also expired. On the November 12th continuing resolution, those were extended through the end of the year. On January 10th, they will expire again, pending a long-term resolution. There are bills in both the House and the Senate with bipartisan support that would extend both of these programs for another decade. However, they haven't agreed on a single form, but it seems likely that there will be some movement on extending these key programs. These are very important because I'd like to take a moment. Most of you are probably familiar with CISA 2015, but it's the bill that provides antitrust protections and protections from being prosecuted for sharing a threat vector with the government or with another organization. So that's a critical piece of the toolkit for cybersecurity defenders against sophisticated actors. So once Congress has resolved that issue, ideally before they expire again in January, we'll come up to the next major program deadline. On March 16th, the Common Vulnerabilities and Exposure Database expires, and that contract is up for renewal. This is already the end of an 11-month extension between CISA and MITRE, who manages this contract. But this is basically the program that establishes a uniform identifier for all of the different types of vulnerabilities that may show up in software or devices or any sort of piece of technology that you may have in your systems. And so if this expires, there's a lot of different questions about who will take over managing that program. Will it remain the same? And how will cybersecurity adjust to potentially not having all of this information so standardized and coordinated? Once we move through this March deadline with some resolution, we'll get to two proposed rules that have not yet been finalized. One is the HIPAA security rule, notice of proposed rulemaking from the end of the Biden administration, which may either be finalized or repealed. This was not statutorily required. It was something that HHS decided that they wanted to do to bolster cybersecurity requirements. And it contains a bit of a stricter definition of what reasonable security is under HIPAA. It lays out a set of requirements, including multi-factor authentication, encryption, and several other practices. So there was a large degree of pushback from the healthcare sector to this proposed rule because it wasn't necessarily tied to any of the other programs that are currently being developed to bolster cybersecurity. Many of the requirements were rather based on whatever the agency thought was best at that point in time, instead of a logical continuation of something like the cybersecurity performance goals. So there was a large push to ask for it to be more harmonized or to be repealed or to be reevaluated to place less of a burden on healthcare providers. We'll find out the fate of that rule in May when the agency either finalizes or repeals the rule. We also we'll find out the fate of Circia in May. This is the Cyber Incident Reporting for Critical Infrastructure Act. This rule is required to be finalized because it was passed by an act of Congress. The rule required tight reporting deadlines for critical infrastructure, including healthcare providers, to go through and tell the relevant agency about an incident that was over a certain size or cost. This also received some coordinated health sector pushback, asking for CISA to harmonize it with other reporting requirements so that there aren't conflicting reporting timelines that draw crucial resources away from actual incident response in the aftermath of a breach or a cyber attack. But we'll find out what the final version of the rule looks like. So this is kind of the environment we sit in, where there could be two very different futures by this time next year, with two very different sets of requirements and two very different levels of government support for healthcare cybersecurity. And just to recap here, I'd like to say a little bit about what comes next. In the administration, there has been a directive that there must be 10 rules repealed for every one passed. So this gives you a sense of how they're thinking about regulatory harmonization, simplification, and consolidation. And it may provide some hints as to what will happen to the HIPAA security rule. We also see a push towards state and local preparedness over federal incident coordination. There was an executive order that required the White House and relevant federal agencies to put together a list of disasters, including cybersecurity, and to then provide funding to the states to address them, rather than providing that funding directly or funding those programs directly through the federal government. So there is also some questions open about, will states have some funding on hand to bolster cyber response and resilience, and how will that affect different states who may handle this in a different way? Finally is federal cyber coordination. There's a lot of open questions, which you may have gathered from this presentation so far, about who's going to step up and actually manage all of these different programs, and who's going to make sure that there aren't duplicative or burdensome or even conflicting requirements placed on organizations trying to respond to an already pressing incident with patient lives or patient care or critical operations at stake. On the congressional side, we're seeing a renewed push towards the intersection of privacy and cybersecurity. Senator Cassidy introduced a bill that would extend HIPAA-like data protections and requirements to wearables and other non-covered entities. We've also seen a handful of bills, such as the Kids Online Safety Act, which has a hearing today in Congress, to strengthen data protections for certain groups of individuals. All of these may add some additional requirements to healthcare and organizations, whether they're covered by HIPAA or not. We're seeing a real focus on regulatory harmonization in Congress. This is a common theme across the board. Everyone recognizes that in the aftermath of an incident, healthcare organizations need to be able to actually deal with the problem at hand. And while reporting and compliance are important, it shouldn't be the only thing on an organization's mind during like the first 24 hours when they're trying to determine the extent of a cyber attack, which systems are affected, and what can be restored. So there's some focus on how Congress may deal with that. And we've heard that there may be some proposals introduced to that extent in the coming months from the Homeland Security Committee. Finally, a newly emerging trend point is supply chain and vendor security. Towards the very end of the last Congress, lawmakers passed a handful of bills that focused on the trust and security of software and OT and IoT components of physical supply chains. So think loading cranes in ports, or key pieces of broadband technology, which are supporting the expansion of healthcare supply chains or the delivery of telehealth or other critical functions. So this approach we expect to be revisited as Congress thinks about what supply chains and enabling infrastructure have to be secure to advance the delivery of care. Um, Finally, I would like to just highlight a few of the recent things we've been thinking about at Premier. All of our comment letters, we share those out in advance. We love working with different coalitions. And our goal is to really create an echo and a unified voice talking about the importance of keeping critical operations up and running, keeping patient care uninterrupted, and actually supporting healthcare organizations, both suppliers and providers. So a few of the issues that we've been tracking here, um, trade and cybersecurity as part of the USMCA renegotiation, harmonization across CERCIA and HIPAA, and a lot of comments about the recent push across all agencies to deregulate or consolidate regulations. Um, so these are some of the things that we've been watching. And we also like to draw data from healthcare systems and members to actually advance some of this agenda. So we recently sent out a survey and collected data from our member organizations about the costs and difficulties of obtaining cyber insurance coverage, for example. So all this to say, we would love your input on what we should be focusing on and ways that we can help make this regulatory ecosystem work better for you. Um, so I'd like to open this up for questions now. I'd love to know what you're most concerned about, what keeps you up at night. What's an emerging issue that you think we should be getting ahead of or should be laying the groundwork for in DC? Or just anything else that I didn't touch on that you're curious about. There's a lot going on in DC, so I tried to hone in on a few things that I think would be directly relevant to the work that you all do.
Thank you so much, Aden. All right, let me open up our Q&A and see what everyone else has put in. All right, so I see our first question in the Q&A. So if everyone, as Aden's going to be working on the first one, please feel free to drop in other questions in there. Aden, the question is from Alicia, and she's asking, how can provider organizations make their advocacy efforts more effective when engaging with policymakers?
Yeah, so that's a great question. And that's really one thing where healthcare and provider organizations specifically have a unique ability to reach out to their lawmakers. Um, Hospitals are huge providers of employment, critical services, healthcare. They are one of the large pieces of infrastructure in congressional districts. And representatives and senators love to hear from their constituents. So reaching out to your representative, scheduling a meeting with your leadership team or your gov affairs professionals if you have them to just go in and share some of the issues you're seeing day to day that interrupt the things that your patients care about, your workers care about. That's the type of story that's really resonant. And when members of Congress are able to hear what's going on in their district and what this means for their local hospital or someone that they're trying to support, that allows you to really like amplify this narrative across the board. So, for example, we recently went and took some meetings with different lawmakers with our CISO, who shared like personal stories about like when there's an incident or when we're working with a member organization to go through an incident. Here's what that means for patient care. Here's what the current regulatory structure, where that gets in the way, and here's the type of support we need to be able to fight back against threat actors that are coming from Iran, North Korea, China, and Russia. So being able to share those firsthand stories is a lot more impactful than a lobbying organization in Washington going in with a couple of statistics. Uh, that's part of like those are part of the meetings that congressional members and their staffs expect to have, and they'll take that information under consideration. But a real constituent story and a firsthand account of what it means on the ground is incredibly resonant and has a lot of power. And so that's the first thing I would say. The second caveat is talk to each other, find some common themes across your organizations, and amplify those same narrative points. If multiple folks are hearing from from health systems providers directly in their district that they're all experiencing the same thing, those guys talk. The delegations talk. They talk on committee. and they'll start to then feel some pressure to do things, and they'll all be informed by the same story that you're all telling together. So those are the two pieces of advice: amplify a shared narrative and give on the ground like testimony to your lawmakers. I would throw one more thing out there. There are a lot of hearings as well. Like I highlighted four of them. There have been probably several dozen at this point in just this Congress that touched something on healthcare, cybersecurity, resilience, preparedness, or something like that. Um, we send comment letters to every single one of those, just highlighting some of these same things that I've shared with you, highlighting member stories. We'd love to highlight your stories in those as well. And we'd welcome you to also take parts of our comment letters, write your own comment letters, and share those narratives with the congressional staff as well. Once you've started to establish those relationships, there's also a chance to actually go in and directly influence the types of questions that are getting asked and the way that lawmakers are thinking about healthcare cybersecurity. I can't stress enough that if healthcare doesn't push to work with government to bolster cybersecurity, it's going to lead to lawmakers viewing cyber requirements as something they have to force onto healthcare providers. And that will be incredibly burdensome, incredibly costly, and probably poorly done. So it's important to proactively offer what would be helpful. What would you like your members to do for you to make you better able to do your jobs? Sorry, that was a bit of a long answer, but this is something I'm very passionate about. You all are uniquely positioned to really have an impact on this in a way that folks here in DC aren't really.
That expertise is the reason you're here, Aiden. So thank you so much for that. And we have more questions rolling in, so this is perfect. George is asking, how does Premier send out updates on the tracking it is doing for healthcare technology legislation and regulation changes? And how can we get access to that update info?
Yeah, so we have our weekly newsletter that we send out. I write a cyber and tech update each week. We'll highlight with like a full breakdown and summary of any major movement. Um, and we'll also have updates on like stats you should know, trends in healthcare cyber, as well as across all different areas of policy. So if you want to shoot me an email on my email here, I'll make sure you get added if you don't already get that newsletter. We also include our draft comment letters in that. Um, Another thing I would include, like if you want to get more directly involved or share a story or do something like that, reach out to me. I'll put you in touch with the different working groups we have around Premier, focused on cybersecurity and other issues like that. We have a lot of forums for our members, a lot of collaborative working groups, and a lot of opportunities for engagement. And I would truly love to get you connected. So please just shoot me an email if you'd like the newsletter or would like to be connected to any of our work there.
I can advocate for that. I get the weekly updates from Show Me as well. So you guys do an amazing job sharing that information. Uh, Daniel is asking, what has been your organization's most effective outreach method to policymakers on the federal level? Are there different methods for different topics that seem to work better? And are there different methods for different political parties that are more effective for organizations to use in your experience?
Mm-hmm. That's a really good question. I'm going to try to take that in parts. Our team schedules meetings. We try to schedule meetings with every incoming freshman over the course of each Congress, and then keep ongoing relationships with the offices that are working on issues that we track closely. So we'll go in, we'll have an introductory meeting. Generally, staff are very open to taking meetings, especially if you highlight yourself as a provider organization who's working on cybersecurity, that they're not going to say no to meeting with you. Once you've had that introductory meeting, if you can provide some sort of story or testimony or problem that they can solve for you, that's the type of thing that they love to do because it's what they're supposed to do, and they can highlight that success, highlight the relationship they're building with you, and highlight the work they're doing with you. So that's kind of universal across parties. Bring some sort of on the ground perspective or story with you. If you have data, bring data. Like, what does it cost you? What does it mean for your patient care? What does it like? What is like the biggest pain point for you? Is it supply chain cybersecurity? Is it like compliance reporting? Take your pick for your issue. Um, and then just keep that relationship ongoing. If you send them some updates, if you see that there's a hearing going on, just stay in touch and build the relationships that way. That's foundational across all parties. Beyond that, there are a few themes for Democrats and for Republicans that we've found have been fairly resonant. Across the board, national security is a great framing. Everybody cares about national security. National security will always be funded, and finding a way to loop protecting hospitals as critical infrastructure into that conversation is a top priority for us. Um, that is particularly resonant with Republicans and those on the Homeland Security Committee. For Democrats, healthcare cybersecurity focuses a little bit more on data privacy and trust. That's a very resonant theme. So saying, how can we better protect patients, protect patient care, protect care if you're in a community where you're like a sole provider, or if you're a rural provider or something like that, highlighting the ability to provide care to everyone and the threat that cybersecurity poses to that. That's a very resonant theme for Democrats and for rural Republicans that we found a lot of success with, and just tying it to the district, highlighting that you're a constituent, or highlighting that if you're talking to a senator, highlighting that you're a major provider in their state and communities are counting on you for care and you need their help to like continue to do that effectively in the face of threats from foreign governments. So those are a few of the themes that we found to be fairly resonant across the board. For Republicans right now specifically, there's a huge focus on trust and like America winning the tech race, the AI race. So highlighting that you're focused on, if you're talking to Republicans, highlighting that you're focused on how do we like secure the tech stack, defend healthcare, those types of themes. For Democrats, highlighting how you, and for Republicans, highlighting like a desire to innovate responsibly. For Democrats particularly, saying like you want to do the right thing, you want to adopt innovative technologies, but you need guidance about how to do that correctly. Or for Republicans, highlighting that you want to like stay ahead of the curve and do new things, and that the current environment and lack of clarity is challenging for that. So those are a few examples. You can kind of see the common themes in this, whether it's security, whether it's innovation, whether it's trust and privacy. Everyone cares about all these things, but you can make slight tweaks to how you pitch it, whether it's to each party, to make it like very appealing to what their focuses are in those themes that I highlighted earlier. Does that answer your question? Happy to keep chatting, and please reach out to me and I'm happy to provide specific examples or share some of our materials that we've taken into meetings.
I think you did amazing with that. And in fact, you even touched upon the next question a little bit, where Alicia is asking if there's any area of bipartisan support for healthcare cybersecurity policy. I know you highlighted the difference between the two parties, but can you tell us a little bit where they're converging bipartisan wise?
Yeah, everyone thinks that healthcare needs better cybersecurity. That's the harsh truth here. There's a divergence between whether they blame hospitals or view hospitals as under attack. We're trying to highlight the narrative that hospitals are being kind of put under pressure by sophisticated adversaries. But across the board, everyone thinks that there needs to be better cybersecurity in healthcare. There have been a lot of major incidents in the news. Our perspective is that there's not a lot that healthcare providers can do to stop a foreign state-backed cyber group from breaking in, but that there are things that you can do to like limit the downside, increase resilience, and kind of make sure critical functions aren't interrupted. So that's one area of agreement. Like everybody thinks there needs to be better cybersecurity. And your chance is to say what you think that could look like in a practical way that like gets at the thing that they all are unified in caring about, which is patient care being interrupted, right? Is patient data being stolen? Another common area of agreement is everyone likes the idea of tech and innovation, either to increase health equity or to increase American like tech dominance, or take your pick. But everybody agrees innovation is generally good, and there are just different approaches to like how to govern it, what governance looks like, what an organization's role is. Another area of common agreement is really national security, and I know I keep coming back to this a lot, but I think it's a very pertinent theme here. I like to say that healthcare is like one of the few critical infrastructure sectors where the victim gets blamed for a cyber attack. if a state-backed bad actor attacks a bank or attacks like an energy company, we would view that as like a foreign country attacking our critical infrastructure. Whereas when healthcare systems get breached, the first thing we look for is like a plaintiff lawsuit alleging that the hospital didn't do enough. Um, and I think that's a very broken dichotomy. And I think we've not received a lot of pushback when we share that narrative with either Democrats or Republicans. Everyone acknowledges that there is a problem here. And everybody generally, when you present the perspective of providers want to care for patients, you don't get pushback on that. And help us care for patients is a really pertinent and resonant message across both parties. Then the fourth one is regulatory harmonization. Everyone acknowledges that there's a problem. It just hasn't risen to the top of the priority list yet. But if you have a problem with having to report to 3 different agencies and 3 different timelines within the first 3 days after a cyber attack, share that story. Odds are they will see a bill about that at some point in the next year. Hopefully that answers that question. I think those are kind of common themes. Everybody cares about these things, just have different ideas of what the right solution is. And this is a chance for you to really shape what that looks like, because you know best what you need to be able to do your job effectively. And I think that is a resonant message across the board for everyone as well.
Yeah, thank you for that detail. I mean, one of the things that always blows my mind in the cyber realm, and when we think about the bad actors out there, even with countries that we get along, if someone from overseas is attacking any institution in the US, the laws that and the work that goes in bringing that bad actor here, apparently like the laws are so old that they don't go through email or fast channels. Like you have those wax envelopes and things that have to be signed. Like it takes years to get any action done on this. So this is much needed. And thank you for all that work that you and Premier do in this very, very needed topic, Aden. So with that, we're going to be moving on to take a short break. We encourage everyone to use this time to explore our virtual sponsor booths. Our partners have valuable solutions and resources that can support your cybersecurity and operational resilience efforts. Your engagement helps make events like this possible, so please take a moment to visit and say hello. We'll reconvene back here at 11:15 Eastern for our next session, Cyber Due Diligence in Purchasing, what to look for when buying connected medical devices and technology. You won't want to miss it. So thank you so much, Aden, and everyone. We'll see you back here shortly.